Hi, I'm Nicole Clark. I'm doing my service learning project on bringing reproductive health care to underserved people. Um, I decided to pick this topic because of the ban in Texas and my fear that Roe versus Wade is in jeopardy, and I think that is terrible. I'm recording on my phone and I have to read off of my computer because I just moved, and also I didn't have any paper to make visual aids. Okay, so with Texas passing its ban on abortions after 6 weeks of gestation, how harmful will this be to women in Texas? And further, as more states will certainly try to enact similar laws as Texas gets away with this ban. On a global scale, how detrimental is lack of reproductive health care to the overall health of society? There are so many questions one can ask on this topic, from abortion bans to lack of family planning, to lack of antenatal care, to lack of care during delivery. The topic is, of course, broad and far-reaching, but exceptionally important, as one can certainly measure the success of a society by looking at the way it treats the people who are bringing the next generation into the world, and the health of the babies themselves. The CDC defines infant mortality rate as the number of infant deaths for every 1,000 live births. This is an important marker for the overall health of the society. In 2019, the U.S. infant mortality rate was 5.6. In the U.S., there is a link between race and ethnicity and increase in infant mortality rates. In 2008, the rate was 10.8 for Black Americans, 9.4 for Native Americans, and 4.6 for white Americans. This, of course, links with socioeconomic group as well, and as we know, this links with lower quality or lack of health care, including reproductive and antenatal care. For this example, I chose a random sub-Saharan African country for reference. In 2019, the country of Chad had 69.1 deaths per 1,000 live births. This is attributed to poor sanitation, lack of food and clean water, as well as poor health care. The maternal mortality rate is exceptionally high in Chad as well, with as many as 1 in 15 women dying from complications during childbirth. That's very, very high. The U.S. has the highest maternal mortality rate of any developed country. In 2019, the average was 12.6 deaths per 100,000 live births, with the rate increasing with maternal age. The number is almost double that of other developed countries, and this rate can be directly attributed to lack of care during gestation, childbirth, and postnatal. Obvious connections can be made between developing countries, lack of adequate care for pregnant persons. Hereby, I'm referring to them as women, but with the knowledge that it isn't just women who can have babies, give birth, and children and the population as a whole. What can we do as a society to improve care for all those who possess a uterus around the world? In the U.S., Planned Parenthood has over 600 locations and serves people in all 50 states, including Washington, D.C. Planned Parenthood is also our nation's largest provider of sex education. As we know, preventing unwanted pregnancies is a great way to prevent complications during those pregnancies. Founded by Margaret Sanger in 1923, Planned Parenthood paved the way for access to birth control and other reproductive services for Americans. Margaret Sanger's eugenic ideals and politics have since been denounced, fortunately. She wasn't a very good person. But the positive aspects of her legacy remain. However, it took well into the 1970s for birth control to be legally available to all women. Through many court cases, victories, and setbacks, women finally triumphed over this misogynistic ideal. However, it is still legal for insurance companies to deny coverage for women's contraception, and this is a big part of where Planned Parenthood comes in. An estimated 1 in 5 women in the U.S. has visited a Planned Parenthood, and they have provided family planning, counseling, and birth control to more than 1.8 million patients. Of the Of the women Planned Parenthood served in 2019, 70% had income levels below the poverty level. Planned Parenthood affiliates provide services to 2.4 million patients, 39% of whom are people of color. On a global scale, Planned Parenthood affiliates have provided healthcare and contraception to 1.76 million people and trained 16,000 advocates. Many mistakenly assume that Planned Parenthood primary focus is to perform abortions. However, that is only a small fraction of the services they provide. Another local organization in San Diego is Family Healthcare Centers of San Diego. They offer all aspects of healthcare from urgent care to pharmacy to private care. One of their focuses is on reproductive health care, implants, birth control, pills, condoms, and Plan B, among others. They offer prenatal medical care, including affordable doctor visits and midwife visits to lactation and social worker visits. I emailed Family Health Care Centers of San Diego to ask a few questions regarding what they offer and ways to support them. I'm going to skip those questions for this because basically I cover them in what I'm saying. And now I'm moving into global coverage. A global organization that is dedicated to bringing family planning, contraception, and prenatal care to women around the world is the World Health Organization. They outlined an extensive plan to put the UN global strategy into play through their strategy for women and children's health. The goal is to implement a global network of research institutions and academic committees dedicated to making lasting policy reform to strengthen developing countries' healthcare systems. So basically, it is a World Health Organization plan to start a plan. I suppose this is how plans and actions come into being. It's a large-scale hackathon, essentially. An organization that I found is bringing contraceptive and family planning choices to women around the world as also another one is the Bill and Melinda Gates Foundation. Their focus is to empower women and girls in the decision-making process in regards to their reproductive health. Their goal is to bring family planning, education, and access to forms of birth control that work for them. Due to education and global action plans, 60 million more women are using modern forms of contraception than were using them a decade ago. So in 10 years, 60 million more women have access to birth control. That's pretty huge. But there are more than 200 million women around the world in low and middle income countries who do not have the access to birth control that they would like to avoid unwanted pregnancies. And we know that unwanted pregnancies, generally at a young age, is one of the biggest factors that destines women to a life of low income due to less access to education and other mitigating factors. Bill and Melinda Gates Foundation partners with local agencies to bring girls and women the education, services, birth control products that they need to take control of their own reproductive health and their futures. I would like to talk about cultural sensitivity. We know that not all cultures around the world believe that controlling the rate of birth or preventing pregnancy is a human right. There are many religious groups, cultures, and societies of people who view women as simply mothers or potential mothers and not as autonomous humans. While it is important to have cultural sensitivity, I feel it is also an important human rights issue. All people in the world deserve to have governance over their own bodies. It is also the case that this subject is a difficult one to broach with more implications that can be addressed in a project such as this. So my plan in the US, I just decided to start at the beginning. I don't think that children as young as elementary school are too young to learn about their own bodies. I think as early as second or third grade, we can begin to teach them about their bodies and the things that go into being a human. Even in our culture, it's taboo to discuss periods, sexual health, and reproductive health at times, but it would be beneficial to all of us if that was to change. I think we could start talking about those things as early as junior high. So only 29 states and DC require that sex education be taught in schools, and only 10 of these states require that this education be medically accurate. Only 20 states and DC require that their education programs require contraception, but 29 states require that their programs stress abstinence. And we know that abstinence-only sex education is not beneficial. It doesn't do anything. It's not surprising the states that require abstinence-only education have the highest rates of teen pregnancy. My plan would start with federal requirements regarding health education to include reproductive education and contraception education at the appropriate ages. Obviously, we're not going to be teaching third graders about sex, but I don't think 7th is too young. Of course, we all feel that education start in the home regarding these types of subjects, but I don't think that this education should rest solely on the families. My plan would also include non-prescription contraceptives, such as condoms, to high school students when requested, probably through a specifically assigned trusted counselor or someone like that, as well as private and anonymous counseling with resources to provide prescription birth control, healthcare, crisis counseling, and abortion services when necessary. Access to resources, of course. I feel that the global plan is very far-reaching, but education and culturing other cultures understand recognizing women's autonomy and choice of their own bodies is a good start. Culturally appropriate means of birth control. I addressed the readings, but we all know about those. And then I did my panel. So this is the Statue of Liberty, and she's pregnant. And my little guy's at the bottom. He's saying, how offensive. I know, I don't think pregnancy is offensive, but I think that some people think that it is. And she's saying if only the Lady Liberty had access to birth control, maybe she wouldn't be with child. And I said reproductive health care is a human rights issue, because of course it is, but some people don't think so. All right, I ran long. Thank you so much. Goodbye.